now in this video, we'll go over another atrial dysrhythmia called atrial flutter.
Welcome to CASRN, where I teach you about all things nursing.
In this video, we'll go through the causes of atrial flutter, the assessment, what it might reveal, and interventions that you can do. So first off, our pacer cells are overactive in atrial flutter. So the SA node's actually not firing, and a bunch of pacer cells are firing all in the atria at the same time, or at various intervals. They're taking over the SA node, but they are doing it together. So atrial flutter is when those other pacemaker cells, not the SA node, fire inside the atria. This is what you might see on an EKG. And before we get too far into this, if you're unsure what a normal EKG should look like, I highly recommend you review the basic ECG and EKG video so that this makes more sense. So when we're looking at this, I've got a question for you. See if you can answer it. Why is there no P wave? Again, if you're not sure, make sure to review the basic EKG video. So the reason that there is no P wave is because the SA node is not firing. So it's not causing proper depolarization of the atria. So in this image here, this is a very typical pattern of atrial flutter called a sawtooth pattern. And I'm sure it's called that way because this EKG looks very similar to the teeth on a saw or a serrated knife. The causes of atrial flutter can be age, just being an elderly person. It can be ischemia, such as something that might happen when you have a myocardial infarction or a heart attack. It can be caused by mitral valve disease or thyrotoxicosis, which is just high thyroid hormone levels, or something like COPD. So on your assessment, you might see a patient who's having anxiety or chest pain. They also are at risk for clots. They may be experiencing dizziness, fatigue, palpitations, shortness of breath, syncope, and they'll probably have an atrial rate of between 250 and 350. So just like an AFib, the blood isn't pumping properly through the atria and it can become stagnant, which leads to clotting. So when you're looking at treatment options, it's really important to make sure that the emboli does not get forced into the circulatory system and cause further problems for your patient. These other symptoms are going to be caused by decreased cardiac output. Simply put, the body isn't getting the amount of oxygen-rich blood that it needs, and your body's going to react in a specific way. So I highly recommend, as you learn to go through these assessments and follow disease pathology, because that will help you understand so much more about why your patient may be experiencing some of the specific symptoms. Interventions that you might see are going to be anticoagulants, like we talked about in the previous slide, for clotting. You also want to look at slowing down the heart rate. So things like digoxin and beta blockers and calcium channel blockers are going to help with that. And then cardioversion is also an option. However, it's not the most recommended thing to do in atrial flutter. Of course, as a nurse, it's really important to be continually assessing your patient. So you might want to make sure that you're looking at their level of consciousness, checking their pulses, always making sure to continually be monitoring those vital signs, especially the heart rate and blood pressure. You're going to administer any medications as ordered by the provider. You want to access their IV, make sure that they've got a 12-lead EKG on, and then when appropriate, make sure that you're educating your patient as much as possible about new medications, any signs or symptoms that they may experience when they return home, and when it would be appropriate to contact their provider or call 911.
As always, we want to go through and practice on our EKGs so that we can make sure we know how to interpret them properly. So we're going to start off with our rate. We're going to count all of our QRS. We're going to go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. So this is going to be 130. Then we want to look at our rhythm and see if we've got equal amounts of squares. So these big squares are 5, so we're just going to count 5 right here. And then we've got another 5 right here, so we've got 10. We're going to do this again. We've got 5 right here, 5, 6, 7, 8, 9, 10. We got 5, 6, 7, 8, 9, 10. Okay, so we're going to call this regular. And then our QRS complex, we can count those. We're going to go 1, 2, 1, 2. Got a 1, 2 right there. So we're going to go 0.04 times 2 equals 0.08. Then we don't have a P wave. There's not a really clear P wave in all of this. We've got maybe a TU or a T jumbled in some way or another. So it's not possible to do our PR intervals, and it's not possible to do our ratios. Now I want to revisit this right here where we've only got a rate of 130. Know that sometimes that atrioventricular node is going to do the job and slow down the impulses from the atrial rate. So sometimes the atrial rate and the heart rate are going to be different because of what the AV node is doing. Its job is to filter the impulses that are coming down from the SA node. And so what we're going to count down here is actually how many times the ventricles are beating. And so sometimes that is going to be lower, but if we were able to actually look at how often the atria were contracting, it would be somewhere between 250 to 350 beats per minute.
So quick review, some of the causes of atrial flutter can include thyroid problems, mitral valve disease, or just simple age. Your assessment is going to include a high atrial heart rate, in addition to things that would be associated with a decreased cardiac output. Your interventions are going to be things that are going to help restore normal sinus rhythm as much as possible and to slow down that heart rate so that we're able to get the perfusion to the extremities and to the organs that are necessary, because a 300 beats per minute heart rate is not sustainable for life.
Thanks for tuning in. Please help me grow my channel by clicking subscribe and follow below.